So, come put yourself onto the T.
The little green marks.
That's it.
Each side, yep.
Where do I look at the camera directly or?
Yeah.
This is so profesh. Oh my God.
Yeah. So, we are just for syncing sound. Can I get you to do a clap? Perfect.
I don't think I did choose my profession. I think it chose me.
For most of my career, I was running away from advice from my high school guidance counsellor.
I got to the age of 30 and thought, well, now I need a real job.
I was interested in doing something where I felt like I was helping people.
Through my experience working in secondary schools, became very interested in the mental health and well-being of the students I was teaching.
It was one of those things that 20 years ago was still very stigmatised.
I felt there was a real lack of youth services.
So I'm here now to support other families and young people who are going through mental illness.
You get exposed to lots of really different and interesting people in this job, and there's no 2 days that are ever the same.
Everybody that works here is so passionate about what they do, and they really do care about young people.
To help families understand not to ever lose hope.
That change does happen and people do recover.
Helping someone out of what can be the darkest time of their lives.
So with every day or every job we do, it could potentially save someone's life.
And the fact that I get to make a difference, a really significant difference in people's lives, in the young people that we work with and the families that support those young people,
is one of the most satisfying things I've ever done in my life.
I'm really proud that I work at Orygen.
We're all in it for the same reasons.
To be contributing to an organisation that's making bigger impact on the community.
Because when a young person becomes unwell, the family is hit pretty hard, you know, whether it be parents or brothers or sisters or neighbours, aunts, uncles. Orygen is one of the mental health organisations that does recognise that and puts a lot of effort into supporting the families as well.
You never get too far from someone who'll remind you of the overall purpose of what we're doing.
When you feel you're part of a team and you're all pulling in the same direction, it's a lot more motivating.
And of course, one of the things that I think keeps the energy in the place is that we actually have young people involved.
In a way that's not tokenistic or superficial, like we are genuinely part of the organisation.
We can be involved in something and then also see the outcome of that.
And I think that's been a really key part to what makes it such a great place to be.
I guess I've always been someone who likes helping people, but I also love to learn. So this is, I guess, the perfect environment to help and learn.
Seeing people get better and knowing that with the right treatment and the right care, people can do really, really well.
I'm always impressed by the strength of the young people that we see.
But I also see such a gap in the youth mental health services that are available in Australia. And I think that young people's voices are the key to bridging that gap.
And we've got a long way to go in terms of being able to offer more accessible, more affordable, more effective treatments.
There are barriers and constraints, and there are people that you see that could really benefit from a certain type of support, but we're unable to get them to access that support for various reasons.
It's a bit of a tragic situation that we end up turning a lot of young people with a need for care away.
I deal with very frustrated young people who put their hand up and ask for help, but when they get to the system, the help isn't necessarily there for them.
You can't solve mental illness, I don't think.
It's just really important to maintain that sort of hope and that kind of naive optimism.
Knowing that you're working towards helping people and trying to improve their lives and have a positive impact.
The thing that I'm most proud of in Platform is it's helping me integrate back into society after being so unwell for so long.
I set up the family work model, so I was pretty proud of that.
Developing an intervention for young people who are anxious and with sleeping problems.
Some public speaking things which are really exciting because I feel they definitely help to break the stigma around mental health issues.
Sort of setting up and delivering the first youth engagement strategy.
The design of the inpatient unit in Footscray.
In the psychosocial group program, the focus that we've brought to the vocational recovery of young people with mental illness.
Convincing people that caring for self is not a selfish thing, it's actually imperative.
Being able to be part of that journey and stick through some of the really tough times with them.
And I'm just proud of the work that we do at Orygen. I think we do an incredible job with young people and their families and carers.
I'm really proud to be able to be part of that team.
If I had a crystal ball, I guess in 25 years' time, I would like to see a service that is really integrated.
It would have a stronger youth voice, so it would be more and more shaped by young people in how services are designed and treatments are delivered.
The supply of service and support
and professional interventions available would far exceed demand.
Yeah, everyone could access quality treatment whenever they needed it and for however long they needed it.
On the same level as other healthcare.
And a strong commitment from government and the community to provide that and to say that's what's needed.
So that we're working on developing a culture and a community that respects and supports young people's health needs across the whole spectrum.
And that there's no stigma attached to doing that. I think that would be a key thing.
If they can expand that and help everyone, then it'll be so much better for young people all around Australia.
So hopefully that will happen in 25 years. Fingers crossed.
Is that all right?
I hope that was okay.
I think that the issue that I would...
Let's cut there.